This is Dr. AJ Shah. I'm talking to Jean Harris. What has happened to her in last few years, particularly in last 4 months. So Jean, Ms. Harris, tell me, where were you 2 years ago in terms of your health?
Overweight, very overweight, aching body, aching joints, short of breath, and like just walking was a chore. So.
How about the medical conditions? What did you have?
High blood pressure, high cholesterol, and I was borderline diabetes at that point.
How about sleep apnea?
Sleep apnea, yeah.
So a lot of major conditions.
Yeah.
And then what kind of efforts you made to lose weight over your lifetime?
Oh my gosh, I've been on every diet you can imagine. I did like the medical weight loss, Weight Watchers, cabbage diet, all those bad things, and it just wasn't working.
And then finally, you decided to consider other options, including surgical options.
Yes.
But before you decided surgical options, what things went through your mind? How did you research to make sure that you get to the right surgeon and right people? What kind of homework you did?
Well, first of all, I was scared to death to do anything that was surgery, called surgery. I was very fearful of that. And I knew people that had the Roux-en-Y, which is the gastric bypass. And then a girlfriend that I knew for a few years, I hadn't seen her in a while, and I saw her, and she had the lap band done. And I just started talking to her, and then, just getting information from other people, and the internet, of course. You can find so much on there, and just checking it out and going. I went to 2 different informational meetings in town, and got all the information I could get.
So your surgery was in November?
November.
And where was your surgery done?
At Sparrow.
And who did your surgery?
Dr. Yanamula.
Dr. Yanamula.
And he's awesome.
Tell me about Dr.
I love
Yanamula.
him. I was kind of skeptical because I had done the OptiFast program at Sparrow.
Yes.
So I was a little skeptical because at the clinic part, I kind of not had a bad experience, but it wasn't.
So if I understand what you're telling me, because many patients have told me that when I send them to the Sparrow weight loss program, their first experience with OptiFast, working with the nutritionist, working with the people, always is a mediocre experience.
Mm-hmm.
And I don't think it's only you who are saying that.
No.
I've heard it, and I think part of it is in my opinion, it's a bureaucracy. And I think I've talked to Sparrow weight management people multiple times that when I refer patients, they need to hold hand of all my patients, because you go with a lot of hope,
Fear.
And fear, a lot of expectations, a lot of lack of understanding what they are trying to do to you. And at that time, if only thing given to you is, here's the OptiFast program, or here's a $3,000 program, go try it, you almost get turned off.
Yes.
But I think they need to be a little bit more sensitive, like you said, to what you go with, a lot of fear and a lot of lack of understanding what exactly they're trying to achieve. And I'm glad you voiced that, because we need to let the proper people know. It doesn't matter whether it's Sparrow or Ingham or any place in the world, that the first experience is the key experience. And I think I'm glad you hang in there and then went through the next step, which is meeting Dr. Yanamula.
Yeah, and
so tell me about it.
He's awesome. I mean, and of course, at the clinic, they were very much wanting me to do I feel like they kind of push you towards the gastric bypass, the Roux-en-Y, and I didn't want that invasive of a surgery, and everybody's different, and it's a choice. And I made sure I let them know that it's my body, my choice.
Yes.
That I had a choice.
Yeah, the key words you use here, it's your body, it's your choice. Because I understand what medical indications are. Sometimes if you have a lot of lose to weight, they say that the gastric bypass, gastrointestinal bypass may be the best option.
Yes.
Because it gives you the largest weight
and
loss,
quick results,
up to 200 pounds.
Yeah.
But I think eventually it comes down to what a patient decides. And I think that's where I feel that patients should be always in charge, patient in charge. That's how I feel. And you made your choice because you know exactly what your body needs.